Okay, the first group of exercises we're going to go over are what we refer to as the level 1 knee exercises. The first one we're going to do is we're going to put a roll of towels or a soda bottle with no soda and a towel around it, something that's going to give you some structure. And it's going to be slipped underneath the knee. And this first exercise is referred to as a quad set. What we're doing is we're trying to get them to contract the quadriceps muscle or the 4 muscles that run across the top of the leg. So what we're going to have Nick do for me here is he's going to push straight down. He's leaving his heel on the ground, leaving his hip on the ground. So he's just trying to flatten whatever, in this instance, the towel, and we're going to tighten up the muscle group just across the top of the knee. In this particular instance, we're going to be holding for 10 seconds, and we send it home with the patients to do it 10 times. So 10 seconds, 10 repetitions. Go ahead and relax. And you see as he relaxes, the knee bends back up, the muscle relaxes. The next exercise we're going to do is also an isometric contraction. This is referred to as the hamstring set. And what we're going to have Nick do is bend his knee up. He's going to dig his heel in. And in this instance, what we're going to want to do is we're going to want him to tighten up the muscles in the back of the leg. And you can see he's pushing down with his heel. He's not drawing himself this way, but in essence, that's what his thinking is that he's digging his heel in, trying to pull himself this way, and that'll contract the muscles across the back. Again, holding for 10 seconds and doing 10 repetitions. The next one that we're going to have him do is a straight leg raise. And so we bend the opposite knee. That's to stabilize the back, trying to make sure that we don't irritate anything in the back muscles. And then we're going to have him do that quad set again, tighten the knee. There we go. And then from this position, he's going to lift this leg up to the level of this knee. Go ahead and do that for me, Nick. Good. And back down under control. Good. Let's do 5 of those for him. There's 2. So he's under control. He's not fast up or fast down. The knee stays straight the entire time while he's doing it. Good. And then we would switch sides. We always want to do both sides because we're always trying to strengthen both the involved side and also the side that's having to do more because the other side has been injured. The next one we're going to show you is a side-lying hip abduction exercise. So we're going to have Nick lay on his side. We have him do the lower leg is bent. That, again, gives you that good, stable base. We're going to have him straighten his knee, and then we straighten at the hip. We know he's doing it right because we have shoulder, hip, knee, and ankle all in a straight line. Okay? We want to make sure that he doesn't rock back off that hip, so you want to make sure that he stays in that good position. We want to make sure that he doesn't bring the foot too far forward because he'll pick up a different muscle group. So what we're wanting to do is when he comes down, we want you to see that his heel is touching his calf. And so we know that he's in a good position. We're going to have him come up about 18 inches off the ground, right there. Hold for just a second, and then go back down under control. And let's do 5 of those for him. So there's 2. You should feel this exercise basically right behind the pocket. It's the muscle group that we're looking at for this is called the gluteus medius, and it's going to happen, like I said, just behind the pocket or behind the seam of the pants is where he's going to feel that. You want to make sure that you don't rock back, move the knee forward, or you don't want to externally rotate. The last exercise, if Nick comes into me and he's got some limitations to his range of motion, go ahead and lay on your back. This last one we refer to as the heel slide. Now, obviously, if you've got full range of motion, this isn't one that you're going to need to be able to do. You're already able to do it independently. But what we're going to have him do is we're going to take a sheet, open that up. We'll put it right around the bottom of his foot. He's going to take both hands. We make sure that he's got a good sliding surface, so we're going to put that sheet right underneath him. And then what we're going to have him do is bend the knee up as far as it'll go on its own. Once he gets to where it's tight, not uncomfortable, but just tight, then his arms are going to take over, and he's just going to pull up a little bit farther, and then he's going to hold in that position, letting the knee relax, and letting all the effort coming from his arms to help him get into that stretched position. Again, this is something we need to go over a duration, so we're going to hold this one for 10 seconds, and we're going to have you do it 10 times. All of these exercises, very important, you make sure that you're not holding your breath. A nice, comfortable breathing pattern. The easiest way to make sure that you're not holding your breath is count out loud while you're holding your exercises. And then we come back down. You let the leg win, but you put a little tension in there with the hands just so that it's not uncomfortable as you return to that extended position. There we go. And if you're doing this right, you want to make sure that you're not irritating it. So you shouldn't feel pain. You should just feel a tight sensation or a pulling sensation. If there's anything sharp during any of these exercises, you stop the exercise and then communicate that to your therapist when you see them on your next visit.